Okay, so today on John Doe, we were going to be doing a suppository. So first I'm just going to get that ready so I clean my little area here. And just looking at the MAR here, I am going to grab a 10 milligram suppository. So now, Bisacodil. So I'm going to hand sanitize here. Okay. Grab this out. I'm gonna do my 3 checks. Bisacodil, 10 milligram suppository, and expiration date looks good, and it's for John Doe. Perfect. And now I'm just gonna do the same checks again. Bisacodil, 10 milligrams, suppository. So perfect. I'm just gonna try to get one in here. Perfect. Then I'm just gonna put it into this little medicine cup. Okay. Put this back. Put this on here. And then I'm gonna do my 3rd check when I actually administer it. So we're gonna go into his room. So knock, knock, knock. Hi, John Doe. It's Madison. I'm back. How are you doing? Doing okay? Yeah. Your stomach is hurting. Yeah, so today I'm here to give you a suppository since you had been backed up lately. So is this an okay time for you? Yes? Do you need anything before we begin? No? And so now I'm just gonna check your patient identifiers. What's your last name and date of birth? And your allergies? No known allergies, perfect. And now I'm just gonna put on some gloves. We're gonna just check for bowel sounds here first, so I'm gonna put the bed up. Perfect. Okay, so first I'm just gonna check your bowel sounds here, exposing only what I need to. So I'm gonna do your bowel sounds first. Making sure to warm it up and clean it before I do it. Okay, sound good. If I heard no bowel sounds, I would listen for 5 minutes in each quadrant. Okay, and so, I'm also looking for distension. And you are a little distended since you are constipated. Any irritation or swelling or redness, and that looks good. And then when was the last bowel movement? 3 days ago? Okay, and any other disorders that you have? Ulcerative colitis, anything like that? No? Okay. So now I'm gonna have you position on your left side. So I'll just have you help me do that here. Making sure not to expose too much. Okay, just have you grab the side here. Perfect. Making sure to straighten this leg and then bend this leg. I'm gonna grab a little back blanket here, just to cover up anything else. So. Okay. Are you warm enough? Yeah? Okay. So now I'm gonna just place a chuck pad underneath. Okay. Doing okay still? Perfect. So I'm just gonna place this on here. Oh. Okay, and then I'm just gonna grab this lube here for the suppository itself. And then I'm just checking, I already did my other check, so it is John Doe, John Doe. And then this is a suppository, okay? Now I'm just gonna get some lube on it. And then I'm just gonna check for anal sphincter control. So going like that, and it puffs and it moves, okay, good. And then I'm just looking for color, any discharge, any bleeding, any hemorrhoids, anything like that, and it looks good. So we're gonna do this. And expiration date looks good, nothing wrong with it. So. Okay. Just gonna put a bunch of that in there. Okay, making sure that that's nice and lubed up. I can grab it. Okay, so like a bullet, we're gonna place it in there. So you're gonna do it. So I'm gonna have you take a deep breath, and while you're breathing out, I'm gonna push it in. So deep breath and out. Good. And then 3 to 4 inches in while you're doing that. So I'm gonna grab new glove here. Okay, how you feeling? So I'm just gonna push down in your butt cheek here to keep that in. I want you to try to hold this for 5 to 10 minutes or as long as you can, okay? And then I'm just gonna grab some wipes here and clean up his bottom. Do that. So there's some really good wipes, and those aren't expired either. So I'm just gonna clean them up here. Good. How are you doing? Doing okay? Okay, so I'm gonna dispose of this. See that? Dispose of that. I'm just gonna, so then I would put him on a bedpan, or if he wants a commode, we do a commode, and making sure if he wants to get up and do the commode, he would use non-slip socks. And because he has had no results, we're gonna be doing a soap set enema. So I'm just gonna keep him on his side. I'll just keep this out. So first, I'm just gonna go get ready. Since you didn't have any results, I'm gonna get your Soap Suds enema ready. So we're gonna be doing a 500 ml Soap Suds enema. So I'm just getting rid of my gloves here. Get on some hand sanitizer. And before, I'm just gonna put your railing up here. And I might as well just put you back on your bottom here. Just leave that for when we come back. I'm just gonna leave the chuck pad right here next to it also. Put you back on your bottom. Okay, put this over here, and I'm gonna put your railing up. So I don't want you to fall out of bed. Put the bed down. Okay, so that would be put down all the way. Then we're gonna go over here. We're gonna grab our bag, hot Soap Suds enema bag. Okay. So we're doing 500 mils. So for this soap packet, it's 1,000 mils per packet, which is 5 mils. But since we're doing 500, we're only gonna be doing half of this, which is 2.5. So I'm just gonna clamp this off here, which it is already clamped. Going to warm this water up. Make sure it's 105 to 110 degrees Fahrenheit. Good. We're doing 500 mils. We're going to measure it on even surface. Right on the bullet. Right on hand. Okay. Now we're just going to get this poured in here, and it is clamped just to make sure, because I don't want that to go all over the floor. So open this up here. Get this poured in here. And when I pull this bag out of the package, I would check for expiration dates, but it was all good. Same with the soap, that's all good too. Okay, just going to hang this up again. And then I would put 2.5 in there. And then we're just gonna prime our tube here. Put this up a little bit. That's not gonna work. Okay, so we're just gonna take this and just gonna prime the tube here. Just a little bit. Perfect. Making sure not to let this touch the sink or anything like that. So then we're just going to place this back on here. All the air is gone. Okay, and then we're just going to bring this over with us. Back over here. Hand sanitize. I don't know why I'm back since you didn't have any results. We're going to be doing a soap suds enema. Do you know what that is? So it's a little fluid that we're going to be putting into your colon, through your bottom into your colon. So it's going to irritate the lining of your colon and try to hopefully push that stool out. And so I already checked your bowel sounds and we already know that you're constipated. So we're just going to do this whole thing again. I'm going to grab my stuff over here. I'm gonna put the bed up again. Put this down. Okay, I'm gonna have you position on your side again, okay? So making sure not to expose overly too much. And making sure to do gentle. So that and this leg's gonna be straight and this one's gonna be bent. So you're in sitz position. I'm just going to cover you up here with a bath blanket. Are you warm enough? Perfect. Okay, I'm going to lay this out here. That down. Bring it in here. Okay. And did you want the bedpan or the bedside commode? Bedpan? Perfect. So, I'm gonna bring this over here. Looks like that one's locked. There we go. See if we can get this to work again. So 12 to 18 inches above his hip. Not gonna work. So we're gonna pretend that it's 12 to 18 inches above his hip. So that did not happen. Okay, so I'm just looking at his bottom area, checking sphincter control again, and it looks good. And so I'm looking for color, discoloration, any bleeding, any hemorrhoids, anything like that again, and it was good before. So first, we're just gonna lube this up here. So we're just gonna stick the tube in here. Okay. And it already does come lubed, but we just wanna make sure that it's nice and lubed up. So it is good. So just throw that in the garbage. Okay, so you're gonna feel me touching back here. So you're gonna feel a little bit of pressure. So we're gonna do this. So we're gonna put it in 3 to 4 inches deep. So we would put that in there, put it in there, and then pull it out, and then I would hold that in the rectum, and then pull this down. Start so it's at his waist and clamp it and then slowly lift it up, which would be 12 to 18 inches above his hip. How you feeling? Feeling okay? No cramping? So if he did start cramping, we would stop it for 30 seconds. Once he didn't feel any cramping, we would start again. But he's saying that he isn't cramping at all, so. Doing okay still? You just let me know if you're starting to feel any pain or anything. Perfect. Okay, well, you're all done. I'm just gonna clamp this again. And then I'm just gonna take a piece of tissue here and wrap it around it. So that if he needs to use it again, if there aren't any results, that's wrapped around it. Okay. Then we're just gonna wrap this right here and save it for next time if there is a next time. Go like this. Perfect. There we go. Okay, so then afterwards I would push down on his bottom to make sure and try to hold that for 10 to 15 minutes, okay? I know it's gonna be a little hard. So I'm just gonna get this out of the way. Now I'm gonna position him onto a bedpan, a fracture pan. So I'm gonna put you on the, you wanna be on the bedpan now? Okay, so I'm just gonna go like this, line it up. So then I'm gonna just have you slowly come back onto the bedpan, okay? Good. I'm just making sure here that his butt is in the middle of it. Since these mannequins are kind of hard to do it. Let me see here. That in the laundry. Let's see. Perfect. You feel it okay? Okay, I'm just gonna put your bed up a little bit. Your head up. Oh, wrong one. There we go. 80 to 90 degrees. Are you comfortable? Yes? Perfect. So I would put this somewhere out of. Okay. And then I'm just gonna leave your toilet paper and wipes by you. Okay, and then your call light is in reach. You just let me know when you're done and I'll come back. So he pushed his call light, he's done. So then I'm just gonna help him get cleaned up all the way. So I'm gonna put you back down, okay? Slowly but surely. Then I would come back, sanitize, and put new gloves on, but it's the same video. So I'm gonna slowly get you off of this, making sure not to get it everywhere. So I'm just gonna hold the bedpan down while you go onto your side. Perfect. Okay, and then I would dispose of this. I put a towel on or something so it's out of reach. So I'll put it right there, and then I'm just gonna clean him up. So I take a wipe, just wipe everything. Perfect. Then I throw that away. And then I'm just checking his bottom for any redness or anything, and it looks good. And then I would document how much stool was left as an outtake, and this consistency, amount, and color. So I'm gonna put you back down on your back here. Okay. Cover you up. Are you feeling okay? Yeah, so I'm gonna put you down here. And I would just document date and time initials for the suppository, and then date and time initials for the soap suds enema. So are you comfortable like this? Yes? Okay, I'm just gonna clean everything up. This would all be taken out. I would document the outtake again. So we'll just put this right here. You got your call lights. You don't need anything? No? I'll be back to check on you in a little bit, okay? You just pull that call light if you need anything.